This talk is really about how community development and anti-poverty efforts can work more closely with health, medical care, population health, public health to get better outcomes for low-income communities across the country. So that's what I'm going to jump into. One of the problems we have is that we have worse health outcomes and shorter lives based on the money we spend on medical care. A lot of these circumstances that affect your health are things that happen outside the doctor's office and in neighborhoods, and that's really sort of a theme of my talk. It's so often people, when they think health, you say health, but they think medical care. And so things we're going to try to focus on is how can we think about community development as health? What's the likelihood of someone born in the bottom quintile ending their life in the top quintile? And this is how this is one of the standard measures of income mobility. And what you find is that the United States does not fare that well in comparison with other rich nations. And so this is why Richard Wilkinson has that kind of cheeky joke. He says, well, if you believe in the American dream, you have to move to Denmark. But the reality is that Raj Chetty at Harvard did this really great study where he said, the United States is a continent-sized nation, it's 330 million people. Let's disaggregate the data across the different regions and see what we see. And what you find is this area in the Upper Plains, I don't know what they're doing right, but they are much more mobile than anywhere in the developed world. And there are some cities that are actually at the Denmark level in terms of mobility. Salt Lake City, San Francisco, Seattle, San Jose. These are cities that are actually doing really well in terms of the opportunity structures in their areas. Places that are doing terribly are Atlanta, Charlotte, Toledo is about almost 1/3 the income mobility that you have in these other places. They would be the bottom of the bottom in an international comparison. And part of the reason why I bring that up is that these are places that are all experiencing the same federal policies. They're all experiencing the same changes in the economy brought about by deindustrialization, by globalization, by technology change, the things that are destroying that once backbone of the lower middle class, the sort of sort of low-skilled mid-wage job. And yet some places are doing much better than others. And so I just want to just kind of plant that idea in your head for a minute. But this is what I like the most because it's the Twin Cities, Minneapolis, St. Paul, and this is a famously well-run city. It's got great nonprofits, great local government. It's got a very low poverty rate and good education system. And still, you'll see on Interstate 94 a difference in life expectancy of 13 years from 2 different off-ramps. But all that's really to say, your zip code is more important than your genetic code. This is something that the commission report really brought home, and that's really a powerful concept for us that work in community development because we are doing urban revitalization, community development, and so we really think of ourselves as being in the zip code improving business. Your body is the sum record of your challenges and opportunities. And too many of the neighborhoods where Americans live are challenge rich and opportunity poor. This isn't earth-shattering conclusions. If those of you who are familiar with Don Berwick's work around the Triple Aim, this is very similar stuff, and he talks about the integrator. Those of you who know Collective Action, the FSG consulting firm, talk a little bit about the pillars of a collective impact, rather, are the same pillars here, basically, the 5 pillars of that. They also say there's 2 preconditions. You have to have leadership and money. And that's when I had that, I just threw that out. I threw that report out the window of my office. I said, you've got to be kidding. If you have leadership and money, you can pick 5 random things and you'll be successful, right? That's the trick. So we're trying to figure out how can you reverse engineer the leadership and money piece, and we think one of it is this community quarterback idea.
With the community quarterback model, we can create new pathways to opportunity through collaboration, team building, working across silos, and focusing on outcomes and evidence. On a football team, the quarterback helps the players work together by calling the plays for the game. What if, instead of a touchdown, the goal was to make sure that every child has the opportunity to realize her full potential? Whether she gets quality education, how she gets to school, if she has healthy meals and regular checkups, can all influence her ability to graduate and succeed in the classroom and beyond. Over her lifetime, this adds up. Every additional year of school she completes represents an 11% increase in her income. Throughout her lifetime, a whole team of players must come together to help her thrive. It's time to rethink how we create progress in America, not only for one child, but a whole generation. We need community quarterbacks to lead the drive to connect people and places, aligning smart policies, smart money, and smart approaches to improve our neighborhoods. We all benefit when a child or neighborhood thrives. It's time to work differently to create opportunity for everyone.
guess the point I would make here, there's too much to talk about on this slide, but there's just so much happening in trying to bring this together. The reconvened Commission to Build a Healthier America focused on bringing community development and health together as one of their 3 recommendations. SoCap Health was this effort to bring together impact investors, social entrepreneurs, and had this amazing, crazy quilt of people you would not expect to be sponsoring a conference. So it was American Academy of Pediatrics, it was Citibank, it was Morgan Stanley, it was the Centers for Disease Control, you know, just a number of different sort of health and community development sort of people coming together to sort of focus on this idea of how do we create a market that values health. There's a ton of money flowing into this. The Healthy Futures Fund is a $100 million fund at Morgan Stanley, and you have access to reduced financing for your clinic if you demonstrate that your clinic has adopted the whole neighborhood as the patient. It's a joint effort with the Local Initiative Support Corporation and the Kresge Foundation, and there's the Healthy Neighborhoods Equity Fund, the California Fresh Works Fund. Those 3 funds right there represent about $500 million in new monies going to this social determinants of health type financing. And so again, many billions of dollars are now flowing to some of this upstream social determinants of health type interventions, and we think we're creating a market for that. We've got a lot of these examples where, like I said before, 90% bad outcomes before, 90% good outcomes afterwards, and yet we have 10 purpose-built communities in the country and 3,570 census tracts where the poverty rate is above 40%. So we need to figure out how can we take this to scale, and this is something that we do not necessarily know how to do yet. We think what's going to have to happen is some type of systems change. At the local level, we're able to make a lot of differences in some places and be better. We could do better than we're doing, in part because I think all of the building blocks that we need are present everywhere. I think the partners that you need are present everywhere. The question is, how do we get to this? We routinize the extraordinary. We don't need billionaire super geniuses to solve our problems. And we think that in order to do that, data is going to be really important. How can we create a better data infrastructure where we can set baselines for communities, where we can create a common language, where we can, across sectors, focus on, coordinate over a shared goal, what the outcome should be, get community buy-in. We can have a sense and respond capability so that we can adjust the intervention as we go, and that we can measure the effects so that we can communicate the success or failure, but hopefully the success, to the community itself, to the institutions that are intervening, and to the policymakers and the funders who are putting the money up for that kind of work. But you also see things like King County and Seattle merging their community development and public health and their economic development sections to create one department because they feel like they're so integrated. In terms of finance, I think this is really critical. I mentioned social impact bonds and some of these new funds. That's really important. I also think the new funding that may come from managing population health as opposed to per procedure from the medical care world may be helpful. We think we think that also community benefit might be a possible source for some of this work. We think that socially motivated investors and the estimates for that are in the tens of billions of dollars in terms of what can be done to bring about people who want to see social change locally, invest in these things, and we think we can create a marketplace that allows for that. I guess basically the point I'm trying to make is we are pretty close to, I think, coming up with an infrastructure and a business model for making some of this stuff work, but we just need to take it to another level. So thank you for giving me a chance to talk to you today.